So today it's my pleasure to introduce Joe Baldelomar to be our guest speaker once again. When I asked Joe if he would speak to our group, he quickly replied, "Of course." Joe has a wealth of knowledge in the field of dementia. Joe holds an MA in behavioral psychology with specialization in neuropsychology from Boston College, along with a foundational degree in philosophy and psychology from Nova Southeastern University. Joe is a certified dementia practitioner and instructor. Currently, Joe is the Care and Support Program Director with the Alzheimer's Association. He is one of 3 research champions for Southwest Florida chapter of the Alzheimer's Association. In this role, he specializes in providing educational programs for the general public and professionals, both online and in person. I've had the pleasure of working with Joe several times with the Alzheimer's Association. He's someone who can actively listen, provide empathy and compassion to situations, and is quick to assess the problem at hand and share possible ideas for the next steps. He's a very genuinely kind person. He has a personal connection to the disease, so let's get ready to listen and learn from one of the best. So Joe, the meeting is now yours.
So, today, what we're going to be talking about is understanding dementia, but also there's going to be some other factors that I have added to this information. So, one of the things that we're going to see today is, understand a little bit about the facts and figures and why it's so important to have that information. We're going to go over what the definition of dementia is, the understanding of the different type of dementias. What are some of the challenges faced by caregivers that are caring for someone with dementia? The big role of empathy, some of the communication issues, and of course the resources that we have in the community. So when it comes to the facts and figures, I'm sure many of you know that every year the Alzheimer's Association puts something that is called the facts and figures from the Alzheimer's Association. And this one pretty much gives us an idea of how we are in numbers. So right now, as of 2024, as you can see, nearly 7 million Americans actually are confronted with Alzheimer's disease. And then if we look as far as the caregivers part, there are about 11 million Americans that provide unpaid caregiver, which relates to almost $347,000 billion. So, those numbers are incredible. And then, of course, we continue to see that 1 in 5 females and only 1 in 10 men actually develops the disease. And sometimes a lot of people ask me, is it because of hormonal issues? Is it because of this? No, there's no gimmicks. There's only one answer. Ladies live longer than men, and that's the only reason why they are more hit with Alzheimer's. Then let me bring a little bit closer to home. In Florida, the statistics are just staggering. And if you think about it, Florida right now is considered the epicenter of the disease. Reason why is because we have the second highest numbers of seniors in the United States. And unfortunately, we have about 6 counties that are in the top 15 counties with most cases of Alzheimer's disease. Again, if you look these numbers, 580,000 Floridians is being diagnosed with Alzheimer's disease in Florida. This number by next year is supposed to increase 17%. By 2050 is supposed to double. That's why it's so important to have these statistics in mind. As you can see again, 480,000 Floridians are living with Alzheimer's. And let's keep in mind that this is actually people that will go and seek a diagnosis. But there are people that unfortunately they might not be covered by insurance, or they just simply doesn't want to follow up and see what else is out there to provide help and care. Another thing that we look about this is, the impact of Alzheimer's when it comes to the numbers. So 2/3 of Americans with Alzheimer's are females, and 60% of the care that provide care to individuals with Alzheimer's disease are also female. Historically, Black Americans are about two times have more propensity to develop the disease, and 1.5 of Hispanic Americans in comparison with white Americans. And of course, the other aspect that we have seen through research is the adults with Down syndrome are an increased risk, particularly with a younger onset of faster progression of Alzheimer's disease. So those are just interesting facts to keep in mind when it comes to the disease. Moving forward, we're going to talk about the definition of dementia and what do we understand is this dementia, right? And we're going to look at the different aspects of dementia. So dementia in general is a syndrome, right? And this is a condition that is characterized by the progressive and persistent loss of intellectual function. When you think about dementia, dementia includes symptoms of behavior, cognition, psychological problems, memory and abstract thinking, limiting social skill. And the one thing that we see in every single type of dementia is the impairment of the thinking abilities that interferes with daily function. So, in a short, this is what dementia is. And then, if you look at this little picture, those are the areas that are affected by the different type of dementia. So we have areas, that those with our motor speech skills, language and sensory speech, memory recall, and of course, the intelligence, judgment, and behavior, which are the ones that are more frequently being shown in different type of dementias. So when it comes to the different type of dementias, the most common types that we have is Alzheimer's disease, which is the most common type of dementia. 60 to 80% of the time when somebody's diagnosed with dementia is because of Alzheimer's disease. You have vascular dementia, just the second one, dementia with Lewy bodies, frontal temporal dementia, and mixed dementia. And lately, what we have seen is the neuropathology prevalence in mixed dementia is that usually someone will develop first some Alzheimer's or vascular, and then it might be attached to Parkinson's or another cerebral dysfunction of the brain. But that's the most common type of dementia. If you actually look or Google type of dementias, probably you're going to come up with 320 some different type of dementia. But these are the most common. Another thing that I like to add is just an information part is that some forms of cognitive decline can actually be reversible. And this is when we're talking about, for example, a urinary tract infection that mimics some of the signs of dementia, and also vitamins deficiency that can mimic the signs of dementia. Once the persons take care of those areas, these temporarily cognitive impairment will go back to normal. So that's what we said. Sometimes mild cognitive impairment can be reversed, and it's just in those specific areas. So Alzheimer's disease, right, is again the most common type of dementia. And what we see here is the problems with memory, thinking, and the behavior, right? Keep in mind what we said at the beginning about what dementia is, right? So here, again, we see that these symptoms will grow so bad that they will interfere with daily tasks, especially when it comes to remembering, short-term memory, and the way that the person behaves. But then we also see issues in later stage of the disease when the person might have problems with speaking, swallowing, balance, and those type of things. So these are things for you to keep in mind on how the disease actually works on the person, right? Again, another thing that I like to say is that Alzheimer's disease, or for that matter, start having problems with memory, is not a normal form of age. So please keep in mind, okay? If you hear different from your doctor, please talk to somebody else. Because if the doctor tells you that you're forgetting stuff because you are getting older, that's not a really good doctor. Again, when it comes to Alzheimer's disease, right? What do we look for Alzheimer's disease? Alzheimer's disease has two interesting hallmarks. The beta amyloid, which is the extracellular deposit in the brain, the form of plaque, and then you got the tangles, which is the hyperphosphorylated tau. And these are like spider webs that attach to the brain cells, therefore interfering with communication, while the beta amyloid goes inside the cells and destroys the cell. That's when you look into comparison. On the left side, you have a healthy brain. On the right side, you have a brain with Alzheimer's disease in an advanced stage. And when we look at the healthy brain, a healthy brain weighs about 3 pounds. A brain in an advanced stage of the disease can weigh sometimes of half a pound. So just imagine about the destruction of the cell. And these are the two hallmarks of Alzheimer's disease. No other disease has these two particular hallmarks. Then we move to the next one, which is our vascular dementia, right? Vascular dementia is very interesting because one thing that we see with vascular dementia is usually impaired judgment when it comes to planning, making decisions, and it's very prominent in the person. It's like one of the first signs that you're going to start seeing, right? Then we have other things like, of course, the second type most common of dementia, but then some of the conditions of blood produce blood to the brain. And therefore, again, we start destroying the neurons of the brain, right? And then the impact on thinking skills will vary widely. So that's why I say, vascular dementia is very important. And then the one thing that we tend to forget is that when it comes to vascular dementia, the way that we have to look into vascular dementia is, anything that will limit the flow, the blood flow into the brain can eventually kill the cells. And we have cells everywhere in the body, right? And this lack of quality blood flow through our body can also cause other damages, right? But these are most dangerous when it comes to the brain. So that's why when it comes to the symptoms, right, we see confusion on the person, disorientation, trouble speaking and understanding speech. One thing that we don't think too much is that, physical stroke symptoms, such as sudden headaches, can actually, down the road, be part of the symptomatology of having vascular dementia. So I always tell people, make sure that anytime that you start feeling this type of headaches, when you feel a little bit of the tingling on the face and stuff like that, immediately check with your doctor, because down the road that can cause severe damage into the brain to the point that the person can develop vascular dementia. And ultimately, like the difficulty walking and poor balance. But the two things that we usually see the most common when it comes to vascular dementia is the part of trouble speaking and also the way of have an actual orderly think, the way that we express thought. So it's important to keep an eye, particularly on this type of dementia. Then, when it comes to Lewy body disease, Lewy body disease is a term that is broad and most of the time includes Parkinson's disease. But for our lecture today, we're going to focus just Lewy body. So the alpha-synuclein protein is the chief component. It's that little cell that you see there on the profile, right? Interesting part is that Lewy body, can be found in other type of dementias, including Alzheimer's and Parkinson's disease, but we don't really know what the function is, which is interesting, right? We not knowing what the function is, but we understand that causes Lewy body. And I just put a little add-on there that, dementia with Lewy body disease is named after Frederick Lewy. He was a neurologist that actually worked with Dr. Alzheimer's during the 1900s. Dr. Alzheimer's first discovered Alzheimer's disease, and then Dr. Frederick Lewy came up with the actual um, cell that shows what Lewy body disease is. Just interesting facts. So again, when we look at Lewy body, the core symptoms of Lewy body disease, as you can see, you might have the REM, which is the REM sleep part, is a behavioral disorder that actually involves dreaming. So we see a lot of hallucinations. It's one of the biggest parts. Fluctuating cognition, type like delirium. We have seen cases where people sometimes will sit down in the afternoons and have complete conversations without any other person. The changes in the reasoning and thinking are also affected. And then the one interesting thing is that, malfunctions of the automatic nervous systems that controls the body, such as sweating, blood pressure, and heart rate, are also affected by this. So sometimes people experiencing Lewy body disease all of a sudden will have these sweats out of the blue. And then, of course, the memory loss is less prominent than what we see on Alzheimer's disease. And the other thing that affects is because, again, Lewy body disease is always attached with Parkinson's. So we see the slowing of movement, tremors, and rigidity. So those are things, facts that we have to look for and keep in mind, we see somebody kind of like having this type of symptoms. And the interesting part is you can see how each dementia kind of relates with another in somehow, especially, in the part of the thinking and reasoning areas. Then frontal temporal dementia, you can see how significantly different they look when they do a PET scan or a MRI. So right on the left, you see Alzheimer's disease. On the right, we're looking at frontotemporal dementia and how it affects the brain. So when you look at the frontal lobe, this area in red, actually, this particular type of dementia starts on the frontal lobe, right? So it's a deterioration in personality and behavior and difficulty in language. Those are the two things that you actually see at the beginning. Of course, symptoms are usually at a younger age. Usually, the diagnosis can occur between 40s and 60s. which sometimes doesn't happen in Alzheimer's disease. Behavior changes often first notable symptoms, right? That's the number one thing that we see, the behavioral changes. And then, of course, the problems with the speech, muscle weakness, and coordination problems. Very prominent when it comes to frontal temporal dementia. And then, remember, when we talk about frontal temporal dementia, we have two different types of frontal temporal dementia. We have one that is called the behavioral variant of frontal temporal dementia, and the other one is the primary progressive aphasia. So those are the two types, and it will depend on the neurologist when they look at the person, which one is more prominent. But these are the two types of frontal temporal dementia that we are currently also looking in research. Again, this is just another quick fact: the frontal temporal dementia used to be called the Pick's disease, just because Arnold Pick, the physician, first described a patient back in the 1800s with this particular type of problems and the deterioration on the behavior and the difficulty when it comes to speech. This is interesting to look, right? Because here we're going to look at the, oops, let me go back. When we look at this, right, we're looking at the comparison and the key difference between frontotemporal dementia and Alzheimer's disease. Because sometimes people tend to confuse them, but they're very specific. As I show you, Alzheimer's disease, nowadays, because of the new technology that we have, we can actually pinpoint and see if there is the development of the beta amyloid and the tau. With frontotemporal dementia, where compared with Alzheimer's disease, as you can see, hallucinations and delusions are relatively common as Alzheimer's progress, but very relatively uncommon on frontotemporal dementia. Another big part is that the behavioral changes, right, usually are first noticeable symptoms of the BVFTD. Remember the two types, right? And this one is most common on early frontotemporal dementia. And of course, again, going back, I'd like to make that as a point that the behavioral changes are the first notable symptoms. Well, in Alzheimer's disease, the first notable changes are the way of how people start losing what is the short-term memory. And then, there is another problems like with spatial orientation, like getting lost, not knowing familiar places, are more common in Alzheimer's disease than in frontotemporal dementia. Just few little things to keep in mind when it comes to the different type of dementias. So what are the challenges that you will face as a caregiver? And I'm sure many of you can pretty much see these. So when we look again at the statistics, 827,000 Floridians actually provide unpaid care for people with dementia, right? That's a big number. Big number. And again, majority of these caregivers are ladies. So let's keep that in mind too. So when it comes to the challenges, right, what we have seen is that there are very common challenges. So like the daily life challenge. How do we create a dementia friendly? How do we manage money, finances? And how do we keep a person with dementia engaged? I'm sure that you have more expertise than me when it comes to this part because I am more like in the theoretical area, but what we have seen is that people living with dementia are prone to fall, and then those who care for people have to have that understanding, that physical part, and how do I make my home more friendly for my loved one? Because unfortunately, people with dementia tend to have goals. It's normal part, right? So trying to make a hazard-proof home-free is the one thing that we tell people. When it comes to money, this is something that sometimes we don't think too much about it. It's a part that we say, well, we don't give too much thought. But what we have seen is a heavily increase of issues when families cannot get in accordance to an agreement, and then they fight for the way that their loved one should be handled. Once they completely lose all their perspectives and reasoning, and usually people ended up going to court. And then the court, well, the court do, since there is not a power of attorney, there is not an agreement. What they usually do is that they appoint a guardian for the person from the state. So those are things that we don't really think too much about it, but it's good to understand. We have a whole bunch of resources when it comes to this. So I will provide those resources at the end. Again, the other part is like, how do we keep our person engaged? So looking after a loved one is part of, keeping those spirits high. And sometimes frustration can take a part. So what we usually have seen is that there are certain types of things that you can do to engage a loved one. And the things that I can tell you is drawing or painting is amazing, and music. Interesting enough, we have a part in the back of our brain that hosts music memories. And this particular area of the brain is barely touched by dementia. Just imagine this. Sometimes you might be driving on your car, and all of a sudden a song pop up and you remember the words, right? But then if I ask you, what do you did 2 days ago? From the moment that you wake up until you went to bed, probably you won't remember half of the stuff, even more. But when it comes to music, all of a sudden those words come up. So these are really good ways to engage loved ones, right? And this is just one of the issues, right? The daily life challenge. Then, when it comes to the physical caretaking, the part of helping your loved one wash and dress, how do you prepare yourself for this? You know, let's say I have seen it like I'm going to use my father's case when I see my mother sometimes struggling to get him up and stuff like that. She needs help. How do you go about getting help? How do you go about preparing that ahead when it comes to the part of the cooking and the cleaning? I always like to put that word, but where to start? The reason why is because again, we have massive amount of information and resources to help people look for different areas that can be of help when it comes to looking for resources in the community. Again, the getting exercise, one of the things that we encourage people after getting a diagnosis, if the person's still able to do, is to have like a 15 minutes of brief walk every day. It does wonders, wonders, wonders. But always, remember that this depends on your loved one's age and any other physical or health related issues that the person might have. But this is a good thing to do. And of course, when it comes to night problems, disturbance, what is the disruption of this? Is that right now there is a new medication on the market specifically for insomnia that has been praised by the neurologists. The only reason why is because it doesn't interact with other medications that the person might be taking specifically for Alzheimer's or another type of dementia, especially um, Aricept and Namenda. So, just things to keep in mind to help. But again, for this, we have so many resources. I just want to highlight stuff because time constraints, we can go on and on about all these different things. Then we have the part of the emotional and mental well-being, not only for our loved ones, but for us caregivers. The one thing that I always tell people is like, if you don't take care of yourself, you're not going to be able to take care of anybody. So when it comes to caring for someone with dementia, I have seen that people feel lonely and sad. Why? Because it's a disease. I'm aware that at one moment in my life, this disease is going to start taking away my memories and all things that make me an independent person, independent human being. So how do we approach these things? How we can help our loved ones? And it's just by understanding that we walk together on this path, right? When it comes to our loved ones. And the one thing that you can also see in our report from the facts and figures is that about 68% of caregivers will develop some sort of chronic health problem, and about 30% of caregivers will develop depression. And these are statistics based on research. The other thing that we see, especially when it comes to Alzheimer's disease, our loved ones sometimes become aggressive, not only physically, but verbal. So keeping a certain uh, shift moods on the person, being aware of the shift moods, especially when it comes to agitation, is very important because nowadays you can talk to your neurologist, and there is a specific medication that actually helps with the aggression. This one just came up, I think it was in last year, 2023, that is specifically for agitation, and it doesn't interact with other medications. It does wonders, but you have to talk to the neurologist because it's only effective in certain stages of the disease. And then, of course, the paranoia and confusion, how we can help our loved one with this, just being aware. And then again, reassuring our loved one that we're there is like number one responsibility of anyone that delivers care for a dementia patient. And again, these are just general stuff. I just highlighted like the most common stuff that I hear from people. So, yes, true. So, what is all this when it comes to the role of empathy, right? What do we understand as empathy? I always ask that question. Why do we understand as empathy? So, when it comes to empathy, the definition of empathy is the ability to sense other people's emotions, coupled with the ability to imagine what someone else might be thinking or feeling. That's empathy, right? But what we have seen on empathy is that number one, allows caregivers to freely express and communicate their emotions. Because you're connecting on a different level, right? You experience self-worth and reduce stress. Another things that enable caregivers to connect at a deeper level with loved ones, very, very loving and deeper level. And lastly, the empathy supports emotional well-being. So keep this in mind. That's the reason and the role that empathy plays for caring with someone with dementia. If you don't have an empathy for the person, you hardly will be able to manage certain things when it comes to the care of your loved one, when it comes to the dementia. I always tell people, think from this perspective. You're looking at a disease that is destroying your loved one, but your loved one still there. So it's just simple fact. And then when it comes to the communication, I'm sure you have seen all this before. It's just to reiterate. So some of the changes that we see is the word finding, replacing words, the repetition, the train of thought, reading and writing. why it's not understanding what we're being saying, and eventually unable to verbally communicate. And then when the person is completely unable to communicate, we go to the nonverbal communication, body language, posture, the facial expressions, gestures. Again, I'm going to use my father as an example. Right now, he's on that stage that sometimes we will have like a 10-minute conversation. The rest of the time, it's just mm, and giving expression with face, like stuff like that. So we have to keep all that stuff in mind to make us a better caregivers for our loved ones and actually be able to respond to certain situations. The one thing that I can tell you when it comes to the senses is that people that are usually entering into the late stage of the disease, touch and smell is very important. It's a way of communicating love and support. And these are the things that we can do to help our loved ones trying to convey information so we can understand better and they can also understand us better. So like, limiting distraction, understanding the behaviors as a form of communication, being patient, and validates the person's reality. This is so important to keep in mind. Lastly, some of the good rules of communications, I always like to start with use gesture and hand motions. Approach from the front, that's very important. Making eye contact. Also recall calling the person by the name. Sometimes, people don't remember who they are. So by you completely repeating that name, it becomes repetition in the brain and it helps. Speaking slowly, short phrases, which is very interesting. Why the short phrases work so better, and it's just because of the retention span in memory. And of course, again, rephrase sentence and avoiding the no or negative words because that can take the content can be taken as an aggression from the person that is actually experiencing the disease. And lastly, provide emotional validation and redirection. This is very important. And, it's just ways for you to keep your loved one engaged and understanding that you're there for them to support them, even if they don't remember who you are that particular day, right? And, I'm just going to share some of the resources. I can send this to Sherry and she can give them to you. But, we have these wonderful resources. And then the one thing that I always tell people is these online support communities. It's just, stuff that if you want to ask questions for people to answer, you can get into these forums and just request information. We have the general website, which is the alc.org, where you can find massive amount of information. This our 24 helpline, the free educational programs that we offer. The one thing that I can tell you, the Alzheimer's Association and ARP Community Resource Finder is great. All you have to do, you're looking for a specific information, you put like neurologists, urologists, pulmonologists, anything that you can think of. Doesn't have to be necessarily medical. You put the name of the stuff that you're looking for, you put your zip code and how many miles of radius you want to look for these resources, and it will give you a listing of all the places in the area. So this is wonderful stuff. This one is the Memory Disorder Clinic. So we have a partnership that actually throughout the state, right? So you can call the one that is closest to you and make a scheduled visit to get a full cognitive test completely free. They don't even ask for insurance information. You can just go. And what that does, the cognitive test is gives an idea based on your age, if you have any other underlying medical issues or medical history, family history. So based on all this information, they can give you an idea where you are in the cognitive levels and to see if you really need to seek help further, like further testing, like more invasive testing, like MRIs and other type of neuropsychological testing. And that's important because we just want it's part of being aware of what's going on in case that we actually need to move forward and start seeing a neurologist. This is also something that we always tell people you can just get. It's called the All Stars, and it's just to understand the warning signs of Alzheimer's disease, step for them. So at the end of this training, it takes like 30-45 minutes. It's a test, like 10 question test. And if you pass the test, you get the certificate that says that you're an all-star. So, it's just good information to have. So you become one more Floridian that is an all-star. And this is just general information how you can join us for the walks as an individual, sharing your information, advocating. And this is the number one thing that I always tell people, we want to see a world with Alzheimer's disease and all other dementias, and we are constantly, constantly looking for that cure. So one day we can have the first person that can walk with a white flower, which will mean that will be the first survivor of Alzheimer's disease.